I am introducing Dr. SAMEER DANI, Head of Cardiology and Director, Life Care Hospital and Apollo International Hospital, Ahmedabad.
Hello, everyone. Good morning.
Dr. SAMEER DANI is using the Abluminous DES stent since the product launching. So, doctor, what is your experience? Because it is around 4 to 5 years you are using the Abluminous DES stent.
Yes, it's been almost close to 5 years now. It will be in February since we are using Abluminous. It's a very interesting stent because I don't think any other stent with biodegradable polymer, with abluminal coating and balloon as well as stent coating with sirolimus has been there in the market for such a long time. That too for such a long time. So very interesting concept, and we have been using it. Gradually the use has been increasing, and we have used it in real world patients. So many patients, I think we have used as a group more than 2,000 patients. We have used more than 2,000 stents, and the experience has been very satisfactory. The deliverability of the system, the stent conformability is very good, and the experience in the en-ABL registry has been very satisfying. The MACE rate across all the subsets of patients has been less than 3% at 1 year, and even at 2 years. Until now we have completed follow-up of more than 1,000 patients, and the MACE rate is around 3.6%, which is fairly good. Even in diabetic subset, the MACE rate at 1 year has been around 3% only. So that's pretty comparable with other groups as well as the other stents also. So overall, the experience has been fairly good.
Doctor, do you think Abluminous DES is a good choice to treat the diabetic patients?
I think so. I think, I mean, to come to think of that, why diabetic? It is good choice for every patient subgroup, but especially so for diabetics because of the reason, I think, is the biodegradable polymer, the abluminal coating, and most importantly, perhaps, the fact that stent as well as exposed parts of the balloon are also coated with the drug sirolimus. Now, when you inflate the stent, the drug delivery, at least the initial burst, is across the entire segment of the vessel being dilated. So it's not only the stent which elutes the drug for those few seconds or that 1 minute which you inflate the balloon, but the balloon also elutes the drug. Now that burst, initial burst, which is fairly uniform across the surface, is probably an important thing in my mind to treat diabetic subset. Add to this the biodegradable polymer and abluminal coating, which kind of encourages better endothelialization, and theoretically I think it's a very attractive concept.
And what do you think about the introduction of the dedicated registry? It's going to be an international global registry for diabetic patients.
Oh, it's very exciting because as we know, proof of the pudding is in eating it. So the concept is very realistic, very exciting, and we ought to put that concept to the test and prove it. So I think it's very exciting that so many investigators across so many countries have come up together, and I'm looking forward to this particular registry.
Thank you.